The next medication that we're going to talk about are the platelet aggregation inhibitors or antiplatelet agents. So from the name itself, platelet aggregation inhibitor. So platelet meaning your platelet, and an aggregation is clumping or clotting or sticking together inhibitor. So basically it inhibits or it prevents the platelet from sticking or clumping together. So that's what the platelet aggregation inhibitors are. What you have to remember with antiplatelet agents or platelet aggregation inhibitors is that they do not work on the clotting cascade. It just prevents the platelet adhesion at the site of blood vessel injury, which occurs before the clotting cascade. So it works in the cyclooxygenase or COX or COX pathway in the platelets. COX-1 and COX-2, those are enzymes that activate prostaglandins that promote inflammation, pain, and fever. And COX-1 produces prostaglandins that activate the platelets. It inhibits the formation of thromboxane A2, which is produced by activated platelets, which has a prothrombotic property, stimulates activation of new platelets as well as increase in platelet aggregation. So it prevents that from happening. And so decreasing vasoconstriction, causing vasodilation, basically decreasing platelet aggregation or prevents platelet adhesion. ADP or adenosine diphosphate inhibitor, it works by preventing platelet membranes from receiving signal to aggregate or clump together. The therapeutic effect of platelet aggregation inhibitors or antiplatelet agents is basically the inhibition of platelet aggregation. Indication for these medications include CAD, myocardial infarction, and thrombotic stroke. So precautions, things that we need to consider, definitely bleeding just because it prevents platelets from clumping or clotting together. And also we have to be very careful with the concurrent use with some proton pump inhibitors such as pantoprazole or Protonix because this may interfere with the activation of antiplatelet agents such as clopidogrel or Plavix, thus decreasing the antiplatelet effect of the medication. So some contraindications for using antiplatelets: active bleeding, right? So if somebody has GI ulcers, recent hemorrhagic stroke, these medications are contraindicated, or we shouldn't be giving these medications to these patients. Another contraindication is thrombocytopenia or low platelet count. So depending on the facility and the provider, sometimes you have to hold the medication if the platelet is less than 100 or less than 150. So some common side effects of antiplatelets, definitely because of the mechanism of action. Common side effect is active bleeding. Sometimes it's obvious, sometimes it's occult. With that, a lot of bruising. So you'll notice that patients who are on antiplatelets bruise so easily. Also, another side effect is thrombocytopenia. So the decrease in platelet count as well as GI upset. And knowing the mechanism of action of these drugs and also possible side effects, these are the nursing actions or nursing interventions that we have to do. Monitor for bleeding. So both obvious and occult. So we want to make sure that when we're assessing our patient, we're monitoring for possible signs and symptoms of bleeding. Also, it's very important because it can cause bleeding. It can affect your platelet count. It is important to monitor or follow our complete blood count or CBC and paying attention to the hemoglobin or hematocrit, HGB, and HCT. And definitely platelet, right? Because this medication can affect the blood counts and can also affect or decrease the platelet counts. Patient education. So this is very important with this medication. You want to educate your patient regarding this drug. What is it for? You want to make sure that the patient knows why they're taking that medication, what are the possible side effects, and also symptoms of bleeding, so then they can report it to their provider or their nurse, as well as some interactions. And in addition to those, it is also very important to make sure to educate the patient to ensure safety and prevention of falling, because that can lead to severe bleeding from falling, because if they're on that medication, then it causes them to not clot as well as other people. So examples of drugs in this class, one is aspirin, right? Aspirin, you have to remember, this can be written as ASA, so aspirin, and pharm class, it can be classified as NSAID or salicylate. You'll occasionally hear about Brilinta or ticagrelor, Effient or prasugrel, and another very common one that you have to remember is Plavix or clopidogrel. Plavix or clopidogrel, it's an antiplatelet agent, so therapeutic class is antiplatelet. The pharm class is platelet aggregation inhibitor. Again, I repeat, This is something that you have to remember. And so Plavix or clopidogrel, its therapeutic class is antiplatelet agent, and the pharm class of this medication is platelet aggregation inhibitor.